Today we're going to talk about one of the most commonly treated problems in a chiropractic office. It's lower back pain. Believe it or not, it's lower back pain. We treat probably about 80% of the people in our office is lower back pain. But as we treat them, we have to figure out exactly where this lower back pain comes from. And really, it's related to what we call the sacroiliac joint dysfunction, which is referred to these joints right here. And we're going to refer to them as SI joints for right now. It's just where the iliums or the hips meet the spine. And this can cause all types of back problems, but more likely it's from sitting too much. And as you sit in a chair all day, you sit on these bones right on the bottom, and it causes the iliums to kind of go into a posterior fixation. And that's what chiropractors treat most often as a posterior fixation of the SI joint. And if these joints are stuck, it can affect how you walk or run. Because walking or running causes your body needs to do what's called nutation. It's a fancy word for the hips moving back and forth. And if they're stuck backwards, they don't move or nutate the way they're supposed to. This can cause lower back pain, which can affect just the lower back. It can affect the SI joint, which is more on the side, or actually the acetabular joint, which is where the femur meets the hip joint. And all this pain can be related to the SI joint. And I'm going to go through some stretches in just a couple minutes and show you how to stretch these joints, which can help to reduce the restriction at the SI joint. These can be done every morning, every night. It's really up to you. They're very simple. What we want to do is take that ilium that we explained earlier, and we need to move it one way all the way, and we're going to stretch it the other way, completely the other way. So get it moving. So when you run or exercise, the hips are moving the way they're supposed to, like this. Okay, so what we do is, Frank, if you'll just grasp behind your leg. I really prefer if you have a spouse or someone in your house to help do this stretch, but you just take the knee as close to the chest. You hold that about 20 seconds. You just want to let it stretch. You can feel that SI joint stretching out because you've been sitting in a chair all day. So you just hold the right leg for about 20 seconds, and then we do the same thing with the left leg. So we've got it completely rocked posterior or toward the back, and now we want to just make sure we take it all the way anteriorly or toward the front. So we'll have him scoot all the way to the edge of the table. This can be done on a bed, and now we just let the leg hang off the edge of the table and just let it stretch. Again, 20 seconds. I recommend all my patients, if you can do this 3 to 5 times every day. This doesn't take very long, and you're just stretching out. It allows those joints to move in the complete rotation. Remember, earlier we talked about nutation, which is the way the hips move when you run or walk. What we're trying to do is recreate that in a slower fashion with a nice, slow, controlled stretch.